Good afternoon, everybody. I want to begin by thanking Brad Fry for inviting me to be here today. I am the executive director of the Mid-America chapter of the Crohn's and Colitis Foundation. I think the last time I spent any considerable amount of time on this side of the river was when I was working for the MS Society. It was how I started my career. And we did a little bike ride called the MS 150. I am not ashamed to admit that I got embarrassingly close to arriving in Godfrey before I realized I put the wrong Lewis and Clark in my phone today. I spent about 5 years at the MS Society. I took a little break from working in nonprofit and worked for a private golf club, doing events and catering. I was their director of events and catering. Unfortunately, it was right before COVID. And if you think trying to cancel a wedding 10 days before for a young lady is impossible, try trying to cancel a Calcutta the weekend of Member Guest Weekend. It was like pitchforks. And I have been here at the foundation for 4 years. And last week I celebrated my first year of executive director. So I'm here in all of my infinite wisdom. It is an honor to be here and to share a little bit more about our foundation. I'm grateful to kind of give you some updates about what we have going on and the opportunities that lie ahead. And perfect. So a little about what we're going to share today. I want to go over what is IBD. Does anyone here, just right off the bat, are familiar with this disease or heard about IBD? We have a few hands. Okay, great. And I'm going to give you the lunch version. I won't get too graphic with anything. I know that it can be a challenging topic to discuss. I want to talk a little bit about who the foundation is and the impact being made. I'll explain who our patients are and what they face in their everyday lives. And then I'm going to highlight some of our key initiatives, including stigma, bathroom access, and nutrition. And then I'll close by talking about what's next and how you might be able to play a role. When we talk about IBD, we mean Crohn's disease and ulcerative colitis. These are chronic, painful, autoimmune diseases that cause inflammation in the digestive tract. They are lifelong, life-altering, and affect every facet of our patients' lives. IBD occurs because the immune system mistakenly attacks healthy gut tissue. The response may be triggered by a mix of genetic predisposition, environmental factors, and imbalances in the gut microbiome. Fun fact, genetically, our Ashkenazi Jewish population is 2 to 4 times as likely to contract this disease, but we are finding in certain studies smoking, microplastics, as far as environmental factors go, all play a role in diagnosis. Right now, about 1 in 100 Americans live with IBD. Most are diagnosed between the ages of 15 and 35. Right when they are finishing school, building careers, and starting their families. Unfortunately, the fastest growing population are children. And this disease impacts children as young as 5 or under. And this early onset, our VEOs, very early onset children, they get a more severe and more complex version. These conditions are not rare. They are present in schools, workplaces, and neighborhoods all around us. A little bit about who we are. The Crohn's and Colitis Foundation is the largest nonprofit, volunteer-fueled health organization dedicated to finding cures for IBD. While there are no cures today, these diseases are treatable, and the foundation is leading the charge to improve lives and drive progress. Over the past 5 decades, more than $500 million has been invested in IBD research. Drug development, the foundation has funded research that supported the discovery of every new drug and biologic for IBD in the last decade, including the development of new treatments for fibrosis and inflammation. Just to give you a sense of how quickly we've developed on these treatments, we have a local doctor who works at Washington University named Dr. Richard Rood. Dr. Rood was diagnosed at age 10. He also treats people with IBD, let me be clear. So he was diagnosed at age 10. He had his entire colon removed at the age of 13, received an ileostomy, an ostomy bag. And at the time, the only options available to Dr. Rood, who is still practicing medicine today, were steroid treatment or really significant surgical intervention. And now we have over a dozen IBD-specific drugs and therapies that are available, and advancements in surgery available, like receiving a J pouch, which is an internal fix for the disease. Through initiatives like IBD Ventures, the foundation helps bring academic discoveries to new treatments and develops innovative products such as wearable sensors and a smart pill for targeted medication delivery. Right now, we do have people testing some of the very first versions of a wearable device like a wristwatch that detects indicators in your sweat. You know, how great would it be to not have to have a colonoscopy to discover when you're having a flare and just wear a device that can tell you when you're going to get one? Or take a pill that can identify where the inflammation lies in your gut and directly target that area. IBD Chorus is the foundation's network of care centers, and we've developed an urgent care toolkit that has reduced ER admissions by 22%, hospitalizations by 21%, and opioid use by 50% in high-risk patients. Our job is to try and keep people out of hospitals, and by programs like IBD Chorus, we're managing to do that. The foundation provides vital educational resources for patients, caregivers, medical professionals, and the public. And for our children, we have the Camp Oasis program. We'll be celebrating the 20th anniversary of Camp Oasis, and pediatric resources that support families with tools for nutrition, school, mental health, and emotional well-being. The foundation also furnishes critical support services to patients and caregivers who often feel isolated. Advocacy at both state and federal levels ensures the IBD community's needs are heard. And the foundation consistently meets the highest ethical standards recognized by the Better Business Bureau and the Wise Giving Alliance. At every level, this work is fueled by volunteers, supporters, and partners who share the vision of a future free of Crohn's disease and ulcerative colitis. Like many of your companies, the foundation has a strong national presence, but is also deeply rooted locally. We are headquartered in New York City, and there are 34 chapters across the country. I serve the Mid-America chapter, which covers Arkansas, Kansas, and Missouri. And I realize that Edwardsville technically falls under the territory of our Illinois chapter. I promised I would be on my best behavior. This is a national movement, but it's a local issue. This affects families, businesses right here in this community. The impact on our patients is enormous. Living with IBD goes far beyond medical symptoms, and it can affect every corner of a patient's life. Ongoing symptoms can reduce the ability to work or attend school. Patients live with stigma and bathroom anxiety, which can lead to isolation. Rates of depression are higher. And even when in remission, we're finding that 40% of patients still live with chronic pain. Over time, 70% of the Crohn's patients and 1/3 of colitis patients will require surgery. I have boots on the ground in Arkansas, this wonderful woman named Amy Carroll. And unfortunately, because this does run in families, her husband lives with the disease and 3 of her 4 children live with the disease. All 3 of those children who are under the age of, I think, 26 have received at least 1 surgery. One of them has already had 4 surgeries. And I want to talk a little bit about the financial impact of living with this disease. It is staggering. More than 3.1 million Americans live with these diseases, and direct medical costs total 23 to 31 billion every year. Patients spend 3 times more on healthcare than those without chronic illnesses, and oftentimes more than some other chronic illnesses. For families, the burden is heavy. Out-of-pocket costs can range from $5,000 to $25,000 each year. The lifelong medications like biologics and biosimilars can exceed $50,000 to $100,000 annually. Hospitalizations, surgeries, lost wages, they cause even more strain. But if you think about how often you have to get a colonoscopy, other surgeries that aren't bowel resection surgeries, as far as fixing fistulas or strictures or things like that, is an ongoing process where you're chronically in the hospital. Employers are affected as well. IBD strikes during the prime working years of 15 to 35, which means absenteeism, reduced productivity, and higher insurance claims. The takeaway is clear. IBD is not only a health issue, it's a workforce issue and an economic issue. I love this slide. This is a comparison of how we stack up to our sister organizations or our other peer organizations. Even though IBD affects more people than leukemia, type 1 diabetes, or multiple sclerosis, the foundation raises only 90 million annually, compared to hundreds of millions raised by our sister organizations. And the difference is clearly not prevalence. It's stigma. Too many people are suffering in silence. The silence leads to less awareness and lower fundraising dollars for research. That is why it is so important to break the stigma, elevate our patients' voices, advance research and care, and build visibility equal to other major diseases. Let's put this into perspective a little bit. I know we have some, like a State Farm representative somewhere in here. State Farm has 70,000 employees across the nation, which means 700 people alone may be living with IBD within that workforce. One company with hundreds of employees navigating this disease often silently, and that's why partnership matters. To close the gap, bring visibility, ensure patients feel seen, supported, and valued, not only by the foundation, but by their employers, their peers, and their community leaders. We launched the Let's Go There campaign to try and tackle some of the issues around stigma. This campaign encourages open and honest conversations about life with IBD. In 2025, the theme of our World IBD Day was Savoring Life with IBD, which focused on food and travel. The campaign has gathered hundreds of personal stories that highlight the challenges and resilience of patients. And it is more than a tagline, it's an invitation to talk, a promise of support, a commitment to cures, and a rallying cry for the IBD community. We've also established the We Can't Wait app. It's for many patients, one of the hardest daily challenges is not the disease, it's access to a restroom. Imagine needing one urgently, but you're told it's employees only. Right now, only 20 states have laws that protect patients in those situations. Missouri is not one of them, but Illinois is. Illinois is on this list, which means that there are probably tax incentives available to people who, for instance, list their company on our We Can't Wait app as an accessible restroom. To address this, we've developed this app. It also includes it's a restroom locator that is available nationwide. And the app also includes a digital I Can't Wait card that patients can show in case of emergencies, helping businesses become more aware and compassionate. Patients use this app every day for work, travel, and daily life. And the feedback that we receive most often is that it's giving our patients a peace of mind. I also want to talk about our nutrition challenges. Food should bring people together, but for IBD, it often brings a sense of fear and anxiety. More than 75% of people that live with IBD worry about eating. That fear can lead to poor nutrition, isolation, and mental health struggles. For children, the consequences can be even more devastating as many face delayed growth. Despite how common these struggles are, most IBD care plans still lack a standardized nutrition guidance. And that's why the foundation has launched the Diet and Nutrition Initiative to change the story for patients and families. We have developed a website called Gut Friendly Recipes. This digital tool launched in 2023 to provide patients with practical guidance. Since its launch, the website has received over 1.8 million views and more than 22,000 registered users. It now offers over 500 dietitian-approved recipes across multiple nutrition plans. Whether that's Mediterranean diet, low FODMAP, or IBD aid, patients can personalize the tool by filtering out foods they can't tolerate, saving favorites, creating meal plans, and accessing expert resources. It's helping our patients remove the fear and enjoy eating. Which brings us to some of our partnership opportunities. I've obviously outlined some of these national programs and apps and websites that you can become involved with. Partnership is much more than sponsorship. It's about creating meaningful, authentic connections between businesses and the IBD community. Opportunities include co-created sponsorships tailored to meet business goals while advancing the mission, co-branded campaigns aligning your brand with ours, product integration highlighting your company's support through events and programs, in-store activations like QR codes linking to the We Can't Wait app. I know, for instance, and everyone's probably thinking, well, everyone knows that Carrollton Bank has bathrooms that we can use, but it's more about providing the visibility to your patients that you care. So for the We Can't Wait app, you can put your star on our map for free and show your patients, that you care and that you've got, accessible restrooms. But you can also engage with them in a deeper way, providing these opportunities. You can advertise on the app itself, and you can make your star a different color that makes you stand out amongst some of the other restrooms. And as far as our nutrition goes, it's something that we've really been leaning into. In fact, we've developed an entire program in our Arkansas area called Epicure, an event where we've established partnerships with, if anyone's familiar with Bentonville, it's a very Walmart heavy town. And so all of the sponsors and partners that we work with are vendors at Walmart. So we've curated this event where they can come up with the recipes, they can own a room, they can go and have food demonstrations. It's an ungala, as Amy refers to it. And we really lean into the customization. So for instance, Palmer's, who creates like coconut products, oils and body creams and things like that. They're able to sponsor our bakery room and create a black bean brownie based on some of the recipes developed in our Gut Friendly Recipes book. They branded it with a Palmer's, and it had their products in it, and it just was a huge hit. You allegedly couldn't tell the difference. I never have time to eat at those things, but I hear it was delicious. And I just want to demonstrate how important it is to our patients that you are embracing this mission with them. 82% of patients say that they are more likely to support companies that partner with the foundation. That means your support doesn't just change lives, but it builds customer trust and long-term loyalty. The foundation doesn't just fund research, it engages millions every year through programs, events, and resources. Partnering with us is not only philanthropy, it's visibility, it's trust, it's connection with a loyal community. It's also a chance to step forward as a leader on an issue that has been long overlooked. Partnership also brings access to a powerful digital platform. The foundation's website users represent millions of people, and page views represent millions more impressions. National social media accounts can be a highly engaged audience, and campaigns can be customized to the demographics you want to reach most. Some of our most successful events and the fastest growing trajectory of support that we've seen are people like yourselves that have these big, meaningful voices and are using them to help us create awareness. We have a gentleman who, this, as far as symptomatically, not a very sexy disease, right? So this gentleman, his friends and his family knew, but he had never shared with any of his business partners or the people that he works with that he lived with this disease. And from him getting involved and realizing that this community exists to support him, he realized the importance of leveraging his voice. He is the president of Pharmacy Health Services for Evernorth. His name is Matt Krollberg. He has stepped up to be a board member. He has used his voice to engage his group of business partners, and we have seen a tremendous increase in support just with his one voice alone. So just to kind of demonstrate how important it is to speak up, to talk about it. If you don't know someone that lives with the disease, just having a mere conversation about it, you'll find, it's everywhere. It really is. Locally, I wanted to highlight a few of our things that we've got going on. This is my baby. This is the Evening of Hope Gala. It's on November 8th, and it's at the Four Seasons St. Louis. Last year was our most successful year to date. We raised over $500,000 to support our cause. And I'd like to say also that it was a very fun party. But we have over 350 people in attendance. We have sponsorship ranges that are totally customizable from $3,500 and up. And we're happy to work with you to customize something. It is a mere 35 minutes away. I checked from Edwardsville if you guys would like to come and join us. And then this is our, obviously you have lots of choices when it comes to foundations and the foundations that you support. This is our Take Steps event, our walk that happens at Creve-Coeur Park, 45 minutes away, in case you were wondering. And this is really the first touch point for a lot of our patients, newly diagnosed patients. They get to come, they get to meet the community, they get to hear about all of the good work that our organization is doing, our volunteers are doing, our medical professionals are doing, and really gain a sense of community. It's a beautiful event. Again, we have opportunities to have booths at this event, to interact. I believe, how many? Caitlin, my right-hand woman here, it's her baby. How many people attend?
This year we have
Almost 500 people attend this event, so it's a great opportunity to get in front of some of our patients. So let's go there. Here are some opportunities to get involved. You can sponsor our gala, you can walk with us at an event, you can connect us to your brand, you can help us explore some opportunities on that national level with some of these. I mean, I have 30 minutes, so I have so many more opportunities that are available to you. But if you connect us to your brand teams, you can also volunteer and advocate. We have opportunities on committees. We have spots open on our board right now. And we have day of event opportunities to volunteer as well. What we'd really like to do is increase our footprint here in Edwardsville. We don't really have much of a presence here. We'd love people to know that they are supported by our foundation here as well, and that they have opportunities to get involved. We'd love to kind of create a sense of excitement here, eventually have some patient-facing education programs and things like that. But we can't do it without your help. So we would really appreciate it. We are grateful for your time, your leadership, your partnership. And together we can bring awareness to our IBD patients. So I just want to thank you so much for your time today. I know I've been gabbing the whole time, but I appreciate it.
Questions?
In addition to the waste outline, getting money, if Brad one was spearhead the service project for our group to add local businesses to, I can't wait on that. Serve campaign, they'll do that.
We can start a campaign for sure. Brad's gonna start it right. But yeah, it's absolutely free to push the start and with our national business development. She's the one that really is our community members and getting them involved, and she has the whole road episode off that's available as far as that goes. Anything else? Thank you again, everybody. Oh, yes.
The children who have IBD diagnosis, is there all medication or medication all their life, or is it get better?
That's a good question. It really depends on the person. So we're just finding that this is even, it has people very different at different stages. Some people can eat something, some people can't. And we'll try this medication and beyond this medication for, I don't know, a month, and then it stops working. Talk about stuff therapy another day, but then, they'll have to go on and try another one, or they don't have surgical intervention. So everyone's journey on this is a little bit different. Hypothetically, yes, there are children who start medication as young as a child and continue on their medication.
Thank you so much. Therapy. Home nursery, and sitting right there with us. So thank you again. And the pot, let's go 50-50.